So we will move this, we will move our content along very quickly. In a blog I wrote yesterday for AURP, I took note of the fact that our nation is grieving the senseless killing of George Floyd in Minnesota. AURP stands in support of peaceful protests to address societal inequities. And as we all know, globally, the world continues to face its worst global pandemic since World War I. Innovation and science are catalysts for a better society and catalysts for change. And AURP members are change makers. And during the course of today and tomorrow, you're going to hear from a lot of change makers. So with that, I want to thank our next slide, and we can thank our co-chairs of the BioHealth Caucus, Rich Bendis, President and CEO of BioHealth Innovation, and he'll be doing the first presentation of the 6 biohealth regions you're going to hear from. And we're going to conclude those presentations with Mark Romney, Chief Strategy Officer at UC Davis and Aggie Square. AURP is a nonprofit, and we rely on our sponsors and our members to keep our operations going. So you see there are the number of members, including the University of Arizona Tech Park, Wexford Science and Tech, University Financing Foundation, Whiting Turner, and Collaborative Real Estate, and Sterling Bay as some of our top sponsors, and other sponsors below. We want to take a special note of our 2 BioHealth Caucus sponsors that came up for this particular conference. CIFA, the Scientific Equipment and Furniture Association, and EAGB, the Economic Alliance of Greater Baltimore, and you'll be hearing more about them, EAGB today and CIFA tomorrow, so stay tuned for both of them. So without further ado, I think we will go directly into our presentations on biohealth innovation districts from around the globe, strategies to increase resiliency. And our first presenter is Rich Bendis, who will present on the biohealth capital region. So history buffs know that the effort led by George Washington to locate the nation's capital on the banks of the Potomac, not in Philadelphia or New York, made the fight over Amazon HQ2 seem like a game of tiddlywinks. Virginia and Maryland ultimately won that battle, and the nation's capital was created between the 2 states and created one of the world's most vibrant national capitals with major bio institutions headquartered in the region. I would note the world's largest biotech trade organization, BIO, which holds its conference next week, is headquartered in DC, but its address is 1201 Maryland Avenue, Washington, DC, which I don't think is a coincidence. So with that, BioHealth Capital Region co-chair and BHI President Rich Bendis, take it away.
Thank you, Brian. You had such a great lead in, you could just continue to go on and do the BioHealth Capital Region presentation. So, and as Brian always says, you always have more slides than anybody, Bendis, so I'm going to do speed PowerPoint for everybody. Thank AURP for putting together this meeting for the BioHealth Caucus in this interesting times we're having and in this virtual world. So thank you all for joining. So as Brian mentioned, I'm CEO of BioHealth Innovation, and we are the intermediary for the region, for the BioHealth Capital Region, which is Maryland, DC, and Virginia. And I guess, who is advancing slides for me, Brian?
Vicky there.
Vicky, okay, so Vicky, I guess I keep saying next. So I mentioned what our region is, and our goal is to become a top biohealth hub by 2023, top 3. We're currently ranked 4th by Genetic Engineering News. Vicky? And this is their annual report on the top US biopharma clusters based on their latest report in 2019. You can see Boston, San Francisco, New York, Maryland, Virginia, DC, which is the biohealth capital region. And about 5 years ago, we were actually number 6. and San Diego and Research Triangle are actually 5 and 6. So we have actually made some growth over the last 5 years. And you can see this criteria that they use is NIH funding, venture capital funding, patents, labs, base, and jobs. And so the challenge we have is we're trying to grow our venture capital funding as we're generally strong in most of the other 4 criteria to move forward. Vicki? I won't go into all of this. All of you will get a chance to see the full PowerPoint, but this sort of summarizes the strengths of the region and the areas that we need to improve upon. We're lucky to have major players, FDA, NIH, CMS, Johns Hopkins, University System of Maryland, and 1,000 companies in the biohealth space in our region. So we have really good critical mass. Vicki? And the other thing is, from an AURP members located in our region, as you can see, there's about 20 AURP members, so very prominent in the Association for University Research Parks. We thank them all for their sponsorship of AURP, and we hope that continues to grow. Vicki? One of the things that we've done in the region since we created the brand 5 years ago is hold an annual conference. And one of the things you can see is the growth of this conference from 2015 to 19, where we went from 600 to 1,200 registrants. We were planning to have it in April. Unfortunately, it's not going to happen. We're going to move it to October, but we'll probably still have that as a virtual meeting rather than an in-person meeting, because we utilize AstraZeneca's facility for the meeting, and they don't think they're going to have all of their people back at their facility before the end of the year. So they're definitely not going to have strangers coming into their facility. So we will all be in this virtual world for the rest of the year, it looks like. Next. The other thing is the biohealth brand didn't exist really before 2011, before biohealth innovation has been created. But it's interesting to see how the brand and the name has been adopted within our region, as well as in other states, cities, and other countries, as in place of life sciences or biotechnology, because we think biohealth is more representative of where this industry is going with the convergence of technology, therapeutics, medical devices, biomarkers, tools, digital, and artificial intelligence. So biohealth is a very good brand, and I'm glad to see AURP has adopted that for this caucus as well. Next.
Thank you, Richard.
Thank you, Brian, for doing that. One of the keys for looking at the strength of a region is, have there been many IPOs, M&A, and we've had a number of IPOs and M&A within the region. And the best part about it is generally the companies that have been acquired, the acquiring company has decided to keep them in the region because of the access to talent and the proximity to the FDA, NIH, and CMS, which gives them the ability to go talk to them very easily by driving rather than having to get on a plane. So next, Vicki. In addition to that, the VC investment in the region has been growing in both the numbers of deals and the dollars that have been invested in the region. And we feel good about this trend. People are starting to recognize the quality of the assets here for investment, and we're getting more top quartile venture capitalists coming into the biohealth capital region. Vicki? And if you look at VC, these are some of the recent successes. And the other thing that we're seeing is a trend for larger investments, because we were not really on the map or on the radar screen of a lot of VCs. But you can see that Viela Bio did a $250 million Series A, Immunomic $61 million, Graybug out of Johns Hopkins $129 million, Thrive, another Johns Hopkins $110 million, Adelaide $131. So at the end of the day, we're starting to see the size of the investments rival what's happening in Boston and San Francisco, which means that people are starting to appreciate the quality of the teams and the assets in the region. Next, Vicki. As we mentioned, the gap that we have in the region is a need for more early stage capital. So biohealth innovation is in the process of raising a $50 million fund, which will focus on the region initially, but also look at the best deals nationally and internationally of people who would like to connect with us. the nice thing about our fund is one of my board members, Joel Marcus, who is going to be a speaker later this afternoon. They have been the leading investor in the United States in life sciences in a number of deals in the last 2.5 years. Most people don't recognize that. They think them about as a real estate firm, but really they are a very active VC investor. And 66% of their deals have been done in companies that do not reside within an Alexandria space, which is very good. But they're going to be the lead investor or LP in our fund. We're in the process of raising. Next. We talked about the need for capital in addition to the fund. We put on an investor conference in partner with JP Morgan and Wilson Sonsini, prominent law firm. We held those at AstraZeneca. And also I see a note there from Mary Morris that as Breathe is one of the larger investments in the biohealth capital region that came out of the Baltimore area. Forgot to mention that, Mary. Thank you for the chat. But we basically are going to have a virtual conference October 19th through 21st, invite about 100 companies and 40 investors to do one-on-one meetings. This has been in person at AstraZeneca, and so we will do it virtually and combine it with our bioforum that we normally do in April. Next. One of the reasons we think this is a very strong region is as you look at the NIH extramural and intramural funding, if you look at just the extramural grants in the biohealth capital region, it's over $2 million. But if you look at the red bar, that's the intramural funding with 6,000 scientists primarily located in Bethesda, Maryland at the 27 different institutes. So if you look at the Johns Hopkins University System of Maryland funding and then add on top of that NIH, you're over $6 billion annual a year for early stage biohealth research going on in our region, which a lot of people don't count that NIH intramural funding, but it is very important to our region as we have a lot of licensing deals going to companies there, and then there are scientists and researchers who spin out, have their year of conflict of interest that they have to have, and then form a company. So we're very pleased to have them in our backyard. Next. The other thing is, if you look at the rents within our region and compared to the other leading biohealth clusters, the biohealth capital region average rents are much lower than what you would experience in New York, Cambridge, Greater Boston, San Francisco. And the other thing is our vacancy rates, which is next, Vicki, is running extremely low. We're running somewhere around 4 to 5% vacancy, which means we're at full capacity, which means we're developers like Alexandria are now doing spec buildings, which we haven't had in the region for a long time, but they feel bullish and are starting to do some spec development in the biohealth capital region. Next, Vicki. One of the other things that's also unique about the region is, you know, the state of Maryland's population, for example, 6 million, but it has 78 federal laboratories, which is more than any other state in the country. And their federal R&D investment exceeds $16 billion annually. In addition to that, you have Johns Hopkins and University System of Maryland. You put that together, it's $20 billion of annual R&D funding coming into the labs as well as the universities within the biohealth capital region. Next. The other thing we talk about also are the unique assets. I've mentioned some of those with NIH, FDA, CMS, HHS, of course, major healthcare change, major academic research institutions, and a lot of non-governmental organizations and disease foundations located within the DC and biohealth capital region. So it's a very robust community that has all of the different elements necessary to build a vibrant ecosystem concentrated within this area. Next. It's not going to work, though, unless you can get academia, industry, government, and these foundations working together, because all of them have their own missions and goals and objectives. So what we have had to do is to find ways to link people in the different sectors, because you have to find overlapping missions where people are willing to work together. And that's sort of how we have built the mission for the biohealth capital region, as well as biohealth innovation. we're seeing more collaboration and cooperation occurring because people respect the other person's missions and goals and find ways that they can help achieve them together. Next, Vicki. We, BioHealth Innovations, a 501c3, we term ourselves as an innovation intermediary that helps connect the assets and the resources. We don't have to control the assets and the resources. The other thing is we have a for-profit subsidiary, and as a nonprofit with the for-profit, we have about 110 client companies. Of those, 30 of them we actually own equity in as a co-founder, or we have earned equity for providing services to them. So we're neither a government initiative nor a membership organization, although the people on our board really are partners with BioHealth Innovation. Next. And this is our board, and it's very distinguished. You'll see Roche, AstraZeneca, Deloitte, GlaxoSmithKline, New Enterprise Associates, the largest venture capital fund in the life science space, QIAGEN, Emergent, which is very prominent in what they are doing to combat COVID-19 right now, and a major recipient of BARDA money because they have been really the one to stockpile anthrax vaccine, and BARDA is going to utilize them for stockpiling and helping manufacture the COVID-19 vaccine whenever that becomes available.
Rich, we're going to need to move ahead quickly. We're
Go ahead. We're almost done.
Well, just quickly, just click through them really quickly.
Yep. I can't. Biohealth is a term we created. It's includes all of those things that you see listed as biohealth. Vicki, you can go rapid.
Yeah.
Our commercial, go ahead. One of the unique things we have is a partnership with NIH with entrepreneurs and residents who help support their extramural activities nationally. Number of EIRs are listed there. Andrea Alms and I are going to be the fund managers of the new fund. So we have the EIRs plus our analyst team, similar to what a venture capital firm would have already in place. Next. We have also an international soft landing program to help people's land in the United States. They find it very advantageous to have proximity to FDA, NIH, and all the companies in the region. Next. And that's a sample of some of the companies that we've been working with in countries around the world. Last. And we're located in Rockville, Maryland, and thank you all for your attention, and we welcome you to come to the BioHealth Capital Region anytime we have the ability to go meet with each other personally again. Thank you.
Perfect. Thank you, Rich. So our next slide, or next presentation, is from Connecticut. So Connecticut is the constitution state for reportedly having one of the first written constitutions of any government, and that's also known as the nutmeg state. Not because nutmegs are grown there, but because Yankee traders in colonial times dealt in Malaysian-grown nutmegs. But what's growing now in Connecticut is bio, not nutmeg trees. So Dawn, the floor is yours.
Thank you very much, Brian. Slides, please. So I am president and CEO of BioCT, and I want to go into how is Connecticut organized and sustained. So we may be one of the smaller footprints in the union. However, we are very powerful and are very driven in the bio arena. This is just an example of some of the companies and stellar academic centers that we have. As you will see from the stars and the lines, New Haven is the main cluster for startup labs and a lot of the growth labs that are spinning out of Yale. And then north of that along I-91 is the Hartford, Farmington region, where you have UConn and Jackson Laboratories, and also the TIP, which is the UConn Incubator Program, which I'll get into. And then along the shoreline on I-95 south is the Stamford, Fairfield area, with Semaphore and a satellite of UConn, and it's becoming our tech center. And then to the northeast is another star, which is Groton, which is where Pfizer is located, and BioCT has a wet lab incubator there as well. So let's move on, please. So how are we organized and sustained? Our pipelines of innovation include the Yale OCR Tech Transfer Office. And they graduate 30 companies approximately a year. It's going to be a little changing over with COVID this year, but they've had a lot of successful IPOs and significant growth of these startup companies within a very short period of time. The UConn TIP incubator houses 35-40 companies. They're pretty much occupied, fully occupied on a regular basis, and they raised a record $263 million in 2019. The BioCT Innovation Commons incubator is up in Groton. We have our incubator up there because Pfizer donated a building to us, and we got funding from the state to create the wet lab workspace. We house about 28 to 30 companies. We are also full, and we have raised about over $100 million, our companies. So our clusters that I've mentioned in the first slide continue to expand in proximity to Yale and UConn. Expansion is organic due to partnerships that are being formed with the universities, the IP, and serial entrepreneurs in the state. The key academic centers, as I mentioned, is Yale, UConn, Jackson Laboratory Institute, and then pharma, Pfizer, Boehringer Ingelheim, and then large bio is Alexion, Biohaven, Isoplexis. We have Medtronics for device, and then these other companies that are just up and coming and growing very, very rapidly. Next slide. So the growth is coming from robust investments. We have our major points of investment in Connecticut is CI, Connecticut Innovations, which is a state-funded arm, and they do a lot of initial funding to help a lot of the startups coming out of the institutes get going. And then we have Canaan Partners, as well as Elm Street Ventures, and we have several angel funders in the state. Demand for lab space is a priority because of the just explosion of growth that we're having. And so with that, and I'll talk a little bit more, but we have the latest building coming up is 101 College in Science Park. The developer is Carter Winstanley, which is very prevalent also in the Boston area. And this is going to be a 10-story building, over 500,000 square feet, and they will be breaking ground in August, which will be certainly a boom for New Haven with the recovery from the COVID pandemic. Many of our companies are involved in clinical trial approvals. You can see them listed there. And our collaborations, there's abundant. Alexion is collaborating with Calum Bioscience, Arvinas with Bayer, Clio with Green Cross Lab Cell, etc. The industry has immense support from Governor Lamont, as well as the Department of Economic Development. Advanced CT is the recruitment arm of the state, and our legislators are very supportive. There is a bioscience caucus with about 40 legislative members in it. Chambers of commerce are clamoring to open up locations in their areas for growth for bio, developers, etc. So on our academic talent pipeline is great, and one of the examples is Southern Connecticut State near New Haven has what's called a BioPath program. And BioPath is an initiative that started about 4 years ago to make sure that the talent coming out of the university not only has the scientific education, but also has practical lab experience. So they have a biotech program called BioPath, and the state is looking to expand that across the state. Next slide. So here's just a snapshot of some of the centers. So again, I've mentioned the Innovation Commons, UConn TIP program. Up in the top right-hand corner is Science Park. And a developer called Twinings just acquired what used to be the old Winchester factory, and they're adding that onto the Science Park area. And so Science Park is hoping to have from incubator space all the way to graduation space within the same park. And then the building in the lower left-hand corner is currently Alexion, and the 101 College project I just talked about is going to be situated right next to the Alexion building. And then there's a third building in the pipeline as well. And that is all going into that Route 34 corridor in New Haven, and that's going to be, Biotech Alley. Next slide, please. So how are we doing this? We have found with some of the movement that happened in Connecticut over the last 10 years, for instance, the headquarters of Alexion moving to Boston, their main R&D center, which houses over 500 employees, is in New Haven. That has not changed at all. They're investing another 11 million right now into expanding in New Haven. And a lot of it is because people don't want to leave. Affordable, the community is a very close network community, great work-life balance, location, between the 95 corridor heading up from the New Jersey, New York, Connecticut, Rhode Island, and up into Boston. We have great tax incentives. I mentioned Advanced CT, who, the bio industry is one of our core anchor industries in the state. So a lot of attention is being paid to it. And here's a quote from John Soderstrom at Yale, again, saying that less than 20% of Alexion employees took packages when they left. Next slide, please. So Connecticut is a very balanced environment. Like Rich already mentioned, we need that. So we've got the economics of public-private partnerships going on. We've got the ecosystem with the stellar universities and incubator space, et cetera. Enjoyment of living here, cost of living, and employment. So in Connecticut is, I believe we're number 3 or number 4 in the state with the highest number of educated citizens in our state from stellar universities. Next slide, please. So what is the impact of COVID and what has our response been? We have really circled the wagons, and there have been minimal interruptions for our laboratories. We were named an essential industry. Investments have continued to flow even during the COVID area. In fact, BioCT, we've gone to doing virtual events, and if you go to our website, you can look at our COVID information and look at some of the virtual panel discussions we've had about investment, and it's a very positive outlook. Our governor has had almost close to 40 now since I wrote this, executive orders, and has done a stellar job in keeping the state safe. And the state also has a coronavirus task force. Many of our key institutes and minds have come together to look at ways to not only with this epidemic, but now future epidemics, because there will be more, on how to pull together key resources and initiatives. Manufacturers open their doors to making PPEs and masks where they weren't doing that before. And many of our companies are working on a lot of therapies, drugs, et cetera. And for a full listing of, again, you could go to our COVID landing page on our website. Next. So highlights. So these are just some companies I picked out. Boehringer Ingelheim has a lot of researchers identifying treatments. They've offered their workers paid time for any volunteer work that they're doing. I think this is fabulous. Their on-site cafeteria was repurposed for feeding the community during.
Hey, Dawn, we're going to need to sum up in 30 seconds just to keep,
oh my
keep
goodness.
everyone else
All right.
time. Yeah.
So you can continue to read on this, please. Next slide. So predictions for the future, it's all going to continue. We're going to just build on everything that's going on. Next slide. That was it. How's that for
Great.
30 seconds? Thank you
Well,
so much
great.
for everybody's time. I really appreciate it.
I think thank you, Dawn. It sounds great. Sounds like a lot of great things going on in Connecticut, and I'm sure there'll be a lot of follow-up. Certainly, I did not realize how much bios is really growing there. So our next presentation is about New York City. So New York City is known as the Big Apple, a nickname popularized in the 1920s by a New York sports writer that covered horse racing, oddly enough. But New York City is big in bio as well as apples, as Nancy Kelly and New York City Bio will illustrate. Nancy.
Thank you, Brian, and thank you to AURP for having us here. And kudos to Dawn and Richard for all the great work they're doing in their innovation districts. That's very, very impressive. In addition to being the president and CEO of Nancy J. Kelly and Associates, I also serve on the steering committee and as a founding member of NYC Builds Bio Plus. This is a nonprofit organization that brings together life sciences with real estate to create the environments that are so needed in New York City right now, because we've got barely a 0% vacancy rate. So next slide. Good news is that New York, the greater New York area is really starting to move. You know, for years, people have lamented the fact that New York has lagged behind Boston and San Francisco as a major life science hub, in spite of the fact that it had the greatest scientific institutions and academic medical centers in the world. But all that's been quietly changing over the last 15 years. And in the last 5 years, especially, life science growth is gathering new momentum in greater New York City. Next slide. It's actually uniquely clustered, uniquely situated at the center of two growing life science clusters, New York and New Jersey, which represent some of the greatest concentrations of corporate and academic life science investment, talent, expertise, resources, and potential in the world. This also includes the suburban cluster north of Manhattan in Westchester and Tarrytown, New York. But just as importantly, greater New York City is located in the heart of the Eastern US Life Sciences corridor, which stretches from Boston, Cambridge, and Massachusetts to Raleigh, Durham, in North Carolina. And with 3 international airports to service it, it serves as a ready point of meeting in between all of those eastern clusters. Next slide. It boasts some of the foremost academic institutions and hospitals in the world, located in Manhattan and Jersey City, which is just across the Hudson River from Manhattan. Some of these include Columbia, Weill Cornell Medical Center, the New York Blood Center, Memorial Sloan Kettering Cancer Center, Rockefeller, Mount Sinai, NYU Langone, and New York Presbyterian Hospital. These institutions have undergone a major shift in the last few years, and many of them have initiated programs around entrepreneurship and the formation of spin-out companies, which is yielding 25 to 30 companies per institution per year now. Next slide. As a result, there are now more than 100 life science companies in Manhattan of all sizes and many more in development, as we'll see. These are surrounded by world-class life science companies in New Jersey, next slide, which include some of the largest pharmaceutical companies in the world in the counties which are closest to Manhattan. And the tech boom with Google, Apple, Facebook, Microsoft, all taking large footprints in Manhattan over the last 2 years, that tech boom creates another unique opportunity for collaboration and innovation for life science companies. Google, for example, has backed 60 health-related enterprises from genetics to telemedicine recently. Next slide. So this region has a very highly skilled workforce that spans both New Jersey and New York City. On the left on this slide, you can see the heat map here, which shows you where the concentration of highest biomedical engineers live, and that is the navy blue and the violet, deep violet there. New Jersey is home to 225,000 scientists and engineers, the world's highest concentration. And New York's life science employment, which is represented in the heat map on the right, you can see the greatest concentration of biomedical engineers in red there on the western side along the Hudson and in lower Manhattan. And this life science employment has seen an annual 3% growth rate, which is outpacing New York City's private employment rate. 50% of this is in research in the physical, engineering, and life sciences, but tests and medical diagnostics are also growing rapidly. Next slide. So the greater New York marketplace is loosely organized around a variety of innovative initiatives and institutions. This slide focuses on the ones in New York. First and foremost are the initiative by the City of New York called LifeSci NYC, and also the initiative by Governor Cuomo in life sciences, which is run by the Empire State Development Corporation. But NYC Builds Bio, New York Bio, Grow Biotech are all promoting the growth of the industry in the city. They're led by the academic institutions, many of whom I just mentioned, independent research institutes like the New York Genome Center, which I was the executive founding director of, and then many, many incubators and accelerators. The most recent one is established by Deerfield, which is creating an innovation center smack in the middle of Manhattan. We also have a very strong showing for synthetic biology. So GenSpace is a community laboratory. New Bio City is an organization of SynBio companies. The Biodesign Challenge brings together graduate students in design with scientists to create new materials and projects. Biofabricate is a company that is looking to create biological materials and replace fabrics and many, many other materials that we use even for building, like bricks today. Next slide. And so these kinds of organizations run the gamut from big biopharmaceutical and big tech all the way to incubators, accelerators, really a convening place for innovators from biotech to healthcare. Next slide. And these are some of the kinds of spaces that you'll find in New York, which are very exciting places to mingle and work. Next slide. And the market accommodates many types and variety of uses, as well as the needed infrastructure, amenities, and support services for life sciences. Next slide. A lot of what has been driving growth is public investment. A few years ago, New York City pledged a $500 million life sci investment, and the state of New York pledged a $650 million life sci investment. This investment has been supplemented by NIH public investment, venture capital, which is rapidly growing, as well as the public stock market and pharma funding. Next slide. So how is this health cluster growing? Next slide. Just as happened in Cambridge and San Francisco over the course of the development of those life science clusters, a number of subclusters are emerging in Manhattan, flanked by 2 live, work, play environments in the Northeast in Long Island City and in the Southwest in Jersey City. Next slide.
Nancy, you have 1 minute.
So this is the East Side Corridor. You can see the names of the subclusters here. Next slide. West Side Corridor runs down, obviously, the Hudson River and is connected by southern Manhattan. Next slide. This is some examples of the public investment that has been made and invested in infrastructure, accelerators, and an innovation campus. We've got 5 new incubators and an increasing emphasis on commercialization, which will be graduating more than 100 companies in the next 2 to 3 years. Next slide. The existing lab space is 100% leased with 3 million square feet needed over the next 10 years. And in response, several new developments are planned or underway by Alexandria, by Taconic Investment Partners, by King Street Properties, Janus Property Company, Google, and Deerfield Management. Next slide. Next slide. New York City's response to COVID-19 was unprecedented as the healthcare and life sciences communities spread into action to obtain the personal protective equipment, tests, and expanded healthcare facilities needed for the city. nycbuildsbio.org has highlighted this in the events that it's held last month, and you can read all about them and listen to the videos on the website. Many companies in New York are also focusing on vanquishing the virus through the development of vaccines and treatments. Next slide. Next slide. So the momentum's been building, it's accelerating. We're very excited in New York. We're really expecting to really begin to rival Boston and San Francisco in the next few years with the growth that we're experiencing. Thank you.
Thank you, Nancy. So we're moving from New York City on the East Coast to Chicago. Chicago, the Windy City, not because of its famous February winds off Lake Michigan, but a reference to the supposed bragging propensities of its elected officials. We have two non-politicians representing Chicago's growing biocluster, Catherine Volwald and Phil Hochberger. The floor is yours.
All right, well, welcome everyone. Can you hear me?
Yes, Phil.
Okay, fine.
You need to speak up, I think.
Next slide. We are going to present where Chicago is in the process. I'll begin with a few slides about, in general, what's happening in Chicago, and then Kathy will take a deeper dive into what Sterling Bay is actually up to these days. I'm going to remind you that Chicago is already ranked number 10, and yet we don't have an innovation district. And I'm going to describe for you three. What we do have is we're land rich at the moment. We have 3 developments of 50 to 60 acres that are prepared now, and I'm going to update you on where they are in that process. Next slide. But before I do that, I want to answer the questions that Brian posed to each speaker. How's your district organized and sustained? Well, I represent not only universities, but the nonprofit sector through the Chicago Biomedical Innovation Alliance, and we're the consultants for them. We've held meetings and discussions and working with the city and the state. Many of us are on the mayor's life science working group. So, but at the moment, there is no governance model yet. We're exploring those with the 3 big developers. And the city is managing the approval process, and that includes 2 TIFs that have been awarded already for 2 of the 3. How's the district growing? I'll describe those for you shortly. What's been the impact of COVID? Well, COVID has been not impacting these 3 big developments we're going to talk about. They're moving forward, proceeding, but the universities, the hospitals, and the biohealth industries have been coordinating, testing, diagnosing, and treating, and I'm happy to report that the state of Illinois, as well as the city of Chicago, was the first to meet the 5 criterion of the CDC to reopening. So we just opened yesterday, and we'll see how that goes as we gradually ramp back up. What are the predictions for the future of these clusters? The plan is to minimize competition between the clusters by focusing each on a different part of the biohealth market. One area will be biomedical, and that's likely to be the Lincoln Yards for Sterling Bay, healthcare on the south side with Farpoint, and agriculture for the DPI in the 78. Next slide, please. So Chicago is ranked 10th at the moment, even without these districts, primarily because we have some existing buildings which are at max, just like everywhere else. And those are, Kathy will describe the labs, but also buildings at University Tech Park on the west side, Chicago Tech Park on the south side at IIT, and then further south at the Polsky at University of Chicago, and a new building that's being planned in the Fulton Market District. But none of those buildings are going to meet these longer term needs, which is why there is activity that we're going to describe for you on 3 districts. I mentioned each of them, the size of 50 to 60 acres already cleared and ready to go. Next slide. So here's where the buildings, the individual buildings are at the moment. As you can see, they're scattered around. One of them is 2 miles north, one of them 6 miles south, and a couple of others scattered around. 6 is where I'm located at Northwestern Medical School, and the CBIA is headquartered. But these are the existing buildings there at Max. Next slide. Here now begin the developments. Lincoln Yards we'll talk about shortly. The 78, which is on the west side here of Chicago, you see southwest side, that's 60 acres. The first big partner will be Discovery Partners. That's University of Illinois Champaign-Urbana, wanting to build, and we'll be building the first building there. It's already been approved, a $250 million building. Mostly dry labs. We'll see whether they build wet labs or not. Next slide. On the further south side is the Bronzeville Lakefront. Farpoint is building that property. It's developing it on behalf of the city, so it's still the city of Chicago owned property. They are lining up their partners in funding. They've gotten one of the 2 TIFs already approved for infrastructure, but it's my opinion that this project is probably going to take 3 to 5 years to really get going. And the same with the 78. This is a major infrastructure project for them as well. The third, next slide, the third property is Lincoln Yards. That's another large development on the north side of Chicago. And it's privately owned. It's already been awarded a TIF, and they have their partners in funding lined up. And I'm going to hand it off to Kathy now to tell you about what's going on there. They're the furthest along.
Yes, well, thank you. Is my video on? Is my mute off? Anyway, I'm Catherine Vorwald. I'm the head of the Life Science Division at Sterling Bay. And formerly, I was Associate Vice Provost at the Illinois Institute of Technology and oversaw their tech park management. And so I soon learned that we were running out of labs for the emerging companies in Chicago. And so Sterling Bay recruited me. They bought this building that you see on your left, and that is the former Stanley Manlurie Research Center. It's a very robust building. It's designed for a single tenant, so it has been a little bit extra work to convert that to a multi-tenant building. As you can see, it's got a great location, I think, on a previous map in Hyde Park. So it's got a very, very nice location next to DePaul. Next slide, please. So here, let's start talking about the Lincoln Yards project. The smaller building on the right, it will be our first life science building to be constructed. It's about 300,000 feet, planned for 50 lab, 50 office robustness, and it's right along the river. And so there'll be some wonderful views from that building. You see on the left, you can see that we have quite a bit of capacity for elevation. We have a very favorable FAR. When you look at the whole Lincoln Yards project, 38% of it is going to be open land, and so we're going to be going tall on many of our buildings. The good thing is Sterling Bay is very experienced in building very tall buildings, so that's a wonderful thing to have. So so the building on the right, we're nearing final design, and we're open for pre-leasing on that, and so we're very excited to get this kicked off. We have control of the land. We have J.P. Morgan as a capital partner on the south side, which is where the life science district is going to be, right next to our entertainment district. So it's just going to be a wonderful place. We're putting in new water taxi stops, so you can take a boat to work on the river. It's really cool. And also new bridges across. We're fixing a difficult intersection and shoring up the river. It's going to be a really wonderful place to work. Next slide, please. So in addition to the future, we do have some other existing buildings that are good for life sciences. One building on the right, 2501 Davie, is out near Argonne. That's a former biotech company. And so it's got some very nice laboratory space. The one on the 600 West Chicago on the left, we have a very large life science tenant in there currently at about 150,000 feet, and they're expanding. Some of you may know that is the historic old Montgomery Ward catalog fulfillment center, I believe is what I was told. So anyway, so Sterling Bay is entering the life sciences in a very big way. We have a transformative project for Chicago, and we're ready to go. We have our capital, we have our land, we're in design, and we're ready for leasing. Thank you.
That's it. We're done.
Yep.
Thank you, Phil and Catherine. I greatly appreciate that. So now we're moving steadily westward. So next we're going to hear from the team Utah. Utah, the Beehive State, the nickname adopted in 1847 to show respect for industry, perseverance, thrift, stability, and self-reliance. The biotech industry later would take root in Salt Lake City and other parts of Utah. So Team Utah, take it away.
Thank you, Brian. We appreciate that introduction and appreciate the opportunity to present here today. Utah has consistently been ranked by Forbes as the top state for doing business with a strong educated population. BioUtah is the state's only life science trade association. We have over 1,000 life science companies in the state, and we've been known primarily in the past as a medical device state, and while still a strong economic segment for us, we've seen significant growth in biopharma with scores of drug discovery and development companies calling Utah home. According to a study by the Kim Gardner Institute at the University of Utah, Utah has enjoyed 26% growth in jobs in the life sciences since 2012, compared to 6% nationally, making Utah the fastest growing life science community in the country. Next slide. That growth has not been lost on the state of Utah. Life science industry has now become a primary focus of economic development by the state. Governor's Office of Economic Development has made it a top priority. With approximately 1,038 companies generating over $7 billion in GDP, it's definitely having a positive effect, especially since the pay scale for life science companies is 45% higher than the average in the state. Next slide. So why has such growth occurred in the life sciences in Utah? Well, we have a very highly educated and young workforce. Cost of living is relatively low. The Utah dividend, we call it. The quality of life is extremely high. Very robust arts and culture for a state our size. Outdoor recreation, best skiing in the country, and national parks. We have a strong educational infrastructure of universities and tech colleges. And our transportation is not yet a clogged system. We have excellent transportation and transit systems. Utah companies are acquired with some regularity, but instead of moving them out of state, most are grown in place, and they bring additional functions here to continue that growth. Universities, particularly University of Utah, are producing a flow of intellectual property and ideas for products. Next slide. The impact of the COVID-19, they asked how that's affecting us. I think it's no different than everyone else. Slowing of elective surgeries, impact on clinical trials, employee impacts, positively increased demand for products from molecular diagnostic companies, which we have many here, increase in demand for PPE products, and forces and methods for conducting business. Next slide. Industry growth has caught the attention of city leadership in Salt Lake City. This map shows the significant density of life science companies in the boundaries of Salt Lake City. The new mayor, Erin Mendenhall, has decided to make biotech her primary focus for economic development. This ties in well with her gentrification plans within the city. Despite a hiring freeze, they have recently hired a director of life science economic development. The industry committee has been formed to advise the city, and this is going to become a significant initiative for Utah and for Salt Lake City in the future. You'll be able to see this as you pass through the airport in Salt Lake City as it starts to advertise the strong biotech presence we have here. I will now turn the next 2 minutes over to Keith Marmer, who's the Executive Director of Technology and Venture Commercialization at University of Utah, a key driver of life science development in Utah.
Thanks very much, Kelvin. At University of Utah, as Kelvin mentioned, we've been a primary driver of startup activity in companies that have not only launched, but grown and stayed in Utah. Some of those companies include Myriad Genetics, NPS Pharmaceuticals, and BioFire, which was recently acquired by BioMaru, and they're playing an active role in COVID testing today. These companies have gone on to raise almost $3 billion in follow-on capital. One of the points Kelvin mentioned is that companies are staying in Utah, but increasingly investors are recognizing the value that Utah's ecosystem has to offer. And so as opposed to having these companies move, they're growing in place. Approximately half of all the life science jobs in Utah can be traced back to companies that have spun out of the university. And those companies have helped bring over 750 products to market since 2000. In recent years, some of the things that we've done to help grow these companies programmatically is focus on end-to-end solutions to bring talent, capital, and resources to bear through a program we call Startup 360. We've also formed a seed stage fund that we call the Pioneer Fund to help early technologies mature. And we're in the process of raising a $60 million venture fund, having just secured a relationship with a fund manager. Slide, please. One of the reasons that the university is able to serve as such a discovery engine are the unique resources that we have. In addition to approaching almost $600 million a year in research, we have a number of unique assets, including the Utah Population Database, which is one of the world's, if not the world's largest genomic database. Discoveries from there include the BRCA1 and BRCA2 genes that led to the first breast cancer diagnostic test that was spun out through Myriad. We formed the first bioinformatics department of any academic institution in the country. We have one of the most highly curated electronic data warehouses for patient records as a result of that. We also have the third largest testing laboratory in the country behind LabCorp and Quest, which provides us one of the largest tissue repositories in the country. Next slide, please. Some of the other ways that we're helping these companies grow include through incubators and accelerators. Some of the ones at the university include recent development of a therapeutics accelerator. We're investing up to $40 million in accelerating therapeutic discoveries. We recently also launched an orthopedics device accelerator, and opening this September in partnership with one of our portfolio companies, Recursion Pharmaceuticals, will open up a 15,000 square foot wet lab incubator in Research Park. And Research Park is a good segue to my colleague, Jonathan Bates, and I'll let him share more about what we're doing there.
Thanks, Keith. As Keith hinted at, we're presently very proud of a very successful research park, inclusive of slightly more than 4 million square feet of space on 320 acres, with a current vacancy rate of near zero. We are in the middle of working on an exciting and aggressive update to our master plan with a goal of completion by October of 2020. We're focused on creating more mixed-use density, including the inclusion of residential opportunities, as well as focusing on filling the gap presently experienced around accessible, convening, and community space, increasing that bumpability factor, as well as more opportunities for versatile space inclusive of wet bench, incubator, and accelerator space opportunities. Next slide, please. And finally, we are excited to welcome everyone to Salt Lake City in 2021 for the AURP International Conference, where we plan to showcase the final product of our master plan, as well as some initial catalyst projects that we hope to have in development by that time. Next slide.
Great. It looks like you're done, Jonathan. Thank you very much for that presentation. And we do look forward to having all the members here and all of the participants come to Utah in 2021. I should mention Jonathan serves on the AURP Board of Directors. And thank you, Jonathan, for your service. So we're going to move finally to the west to Sacramento, and another AURP board member, besides being co-chair of AURP Biohealth Caucus, is Mark Romney, who also serves on the AURP board. Thank you, Mark. Sacramento, the capital city of California, would be is the capital city of California, and California would be the 5th largest economy, as Mark reminds me often, if not part of the United States. One of the great musical tributes to the city is Sacramento, a Wonderful Town by Middle of the Road, a Scottish pop band from the 1970s. I urge you to get to the YouTube and listen to it. It's very good music, but I don't think they ever visited Sacramento because they lived in Scotland. But Mark is a vital part of the biohealth ecosystem in Sacramento, and they're doing great things at UC Davis Health System. So Mark, the floor is yours.
Great, Brian, thank you so much. Let's go ahead and go to the next slide, just to keep time. So as many of you may be aware, the University of California, UC Davis, is one of the 10 campuses within the University of California system. 5 of those campuses have the UC Davis Health Medical Centers as well. Next slide. UC Davis is home to 10 schools and colleges, medicine, nursing, veterinary medicine, which is #1 in the United States, Ag School, which is ranked #1 in the United States. Both the vet school and the Ag School, I think, are ranked #2 in the world. Our College of Biological Sciences, Engineering, Letter Sciences, Education, Graduate School Management, and Law School. Next slide. The UC Davis Health is located on the Sacramento campus, which is roughly 20 miles from the main campus in Davis. The Sacramento campus, as illustrated here, is located on 148 acres of university-owned land, of which we have 3.5 million square feet of university-owned buildings. In addition, we lease about 1 million square feet in the local region just for UC Davis Health. Again, that's comprised of the School of Medicine, the Betty Irenes School of Nursing, and our medical center. The Sacramento campus is divided into sort of 4 sectors. We call the hospital, inpatient, the clinical or outpatient, education, and the research zone. So if we go to the next slide. Oops, for some reason the graphics are off a little bit. But so basically, with regards to the School of Medicine, industry partner ecosystem that we were talking about, the School of Medicine has over 750,000 square feet of laboratory space on the Davis and Sacramento campus. In addition, we have another 50,000 square feet on the Sacramento campus that we lease to selected industry partners, from the small and medium enterprises to large global companies, as well as numerous school of medicine startup companies. So recognizing the accelerated growth in research funding by the School of Medicine over the last 10 years, we were ranked on the NIH Blue Ridge funding, we were 62nd, ranked 62nd of all medical schools, jumped all the way up to number 26. Without a lot of additional new research space. And there was an increased desire by industry to co-locate on the Sacramento campus with us. We launched an initiative to build an innovation district on the Sacramento campus called Aggie Square. So the master plan, which should be highlighted where it shows red there, basically from that zone all the way down below, is about 25 acres of land. We did a master plan that projected approximately 3.5 million square feet of space. We've developed and identified a first phase, which is slightly under that red area in there on the graphic. For some reason, it's off scale a little bit. And that first phase is approximately 1.2 million square feet, comprised of 600,000 square feet of life science laboratory space, 300,000 square feet of office space for continuing professional education, a lot of the policy and community-based research programs at the university, digital health, and several industry partners. We also have housing units for faculty, staff, students, and industry partners or university affiliates. Our project is currently in design, and we expect to break ground in January with a completion of like summer of 2023. Next slide. And here's the graphic. We do have new renderings. We just haven't released them publicly yet, but basically looking into 2 life science buildings, lifelong learning, which is our office building, and then the housing, and a first floor podium with some more food, nutrition, food health focused programs. Next slide. And then COVID-19 hit. We were one of the first hospitals in the United States to receive a locally transmitted COVID patient back in February. And since then, UC Davis Health continues to lead the region in the development of COVID-19 testing by creating our own test kits, swabs, and advancing clinical trials for potential therapies. Our response and engagement with industry amplifies and reaffirms our belief that innovation districts are critical for the future. One of the most interesting promises and examples of innovation ecosystem is that of our industry partner, Vendari. Next slide. Vendari invented what's called a vaccine patch, which is a single-dose vaccine kit that uses a dermal patch, as shown on the screen, that is made up of a microarray of microneedles, metal microneedles, to deliver the vaccines. The technology eliminates the need for refrigeration, facilitates high-volume automated manufacturing of vaccines, and can potentially be self-administered by the patient. Vendari was founded to enable a rapid response to viral threats, as well as to produce more effective vaccines for existing viruses, such as seasonal flu, while sharply reducing cost and making vaccine administration much simpler. Their new approach and previous work enabled them to quickly bring a potential vaccine against COVID-19 to preclinical testing. Preclinical testing of the immune response to the vaccine began May 1st at UC Davis. If the preclinical testing meets safety and efficacy goals, phase 1 human clinical trials can begin very soon. In preparation for the human trials, Vendari is working with UC Davis's Good Manufacturing Practice, or GMP facility, to manufacture the clinical version of the vaccine. This example of collaboration between Vendari and UC Davis exemplifies the value of industry and academic partnerships and how they can advance innovation solutions. Another example is the global pivot to online learning and workforce training, especially in the life science sector. We are partnering with community colleges and other universities in the region, as well as industry focused in cell and gene therapy manufacturing, to create online training programs for entry-level positions, everything from the machine operators to the QA/QC process engineers. These efforts will not only lift the community and provide jobs for trainees, with the companies planning to move to Aggie Square, but as well as feed the region and provide a sustainable platform for pre-qualifying these employees before the entry-level physical lab training modules and people can return to the classrooms. There's no question that it is critical to upskill our labor force in the region, especially in life sciences now more than ever. Next slide. In addition, we have engaged with our colleagues in China. Recently, I arranged a web conference between the UC Davis Health leadership, our frontline physicians, the hospital leaders, and city government officials in Chongqing, China. We exchanged lessons learned in responding to COVID-19, its spread, testing, and treatments. So in closing, innovation districts, in my opinion, will transform the resiliency of the communities by blending the ecosystems of anchor institutions with industry and the community. I anticipate that it will have a profound impact on the and positive education platform of the future with classes that are more experiential than didactic. Leveraging the collaboration of industry and academia, providing internships and jobs for the students. There's no question in my mind that industry and academia need to partner to train the workforce of tomorrow and inspire the next generation of innovators. When Aggie Square is up, I'll be happy to invite all of you out to visit Aggie Square. And thank you for the time.
Great. Thanks, Mark. I think we have time. If the other panelists want to turn on their cameras, that's fine, and unmute themselves. We just have a time for one question, and it's sort of generic. And Michelle Welly from Economic Alliance of Greater Baltimore posted this. You know, the cost of life science is very high. So for a lot of it has to be subsidized. How do we subsidize the cost of life science space for small startup companies? Is it through incubators? You know, New York City, obviously very expensive. All space in New York City is expensive, but life science is particularly, and that's going to be true for all of your districts. Can you just talk a little bit about how you provide subsidized space for startup companies? And anyone can jump in here.
So when the question asks for subsidized space, I'm not clear what she's defining as that, but you know, certainly the incubator space is, you know, that all of us have, you know, would be the best solution for startup space. I don't know how everybody prices out their space, but incubator space, depending upon where you look, can be affordable. Depending upon the economics, et cetera, and the competition in the area.
Well, Brian, this is Catherine from Sterling Bay. Yeah, so at the Illinois Institute of Technology, that incubator, the tenant improvements were paid for by a combination, not all at the same time, by the state of Illinois and the federal government through an EDA grant. So we were in a university building, so we didn't have to pay rent. But so that facility was really heavily subsidized, particularly in the beginning, by the university, but also down the road by the EDA. Where the challenge comes is when you have incubator graduating companies that move into commercial space, and they soon realize that their gross rent at the incubator is usually around the market's triple net, and then they have sticker shock. You know, so I think that's really, you know, the idea of moving these companies through the incubators on a more regular basis and get them ready to pay rent that's not subsidized, I think is an important consideration for the health of a cluster.
Okay, I don't know if Nancy's still on, because it'd be interesting to hear the perspective from New York City, but.
Yeah.
No, I'm here.
Okay.
I just can't start my video for some reason.
Yeah, I can't start mine either.
So in New York, you know, the city has backed a number of incubators with the LifeSci NYC program that's backed by the mayor's $500 million program. And a few of these are SOSB, for example, which is located in San Francisco, just announced that they're coming to New York City, and they're actually going to be giving companies that are developing therapeutics up to $2 million in financial support once their business plan is approved and accepted. And they have opened temporary lab facilities at Rockefeller University right now, and they're looking for a permanent campus. Other incubators that have been backed by the city are Harlem Biospace, theLabs with Johnson & Johnson. And there's an academic-led model as well, Biolabs at NYU. And of course, we have Launch Labs at Alexandria, which is backed by Alexandria.
Great. Okay, I think we're going to have to wind that up because we want to save time for our keynote speaker. So thank you all. Again, I would encourage everyone to post your name on the chat, you know, introduce yourself. Most of you, some of you know each other, some of you may not, but a good way is just post your name and your company and who you are and maybe your email on the chat. And that way we can get some further networking going on after the discussion. So with that, before we